In section 4, we want to talk about the Smart Cloud process. So what is this change in our problem list process going to look like when you make entries into Smart Cloud? First, let's look at the timeline. So training will begin week 5. All faculty are trained week 5. It'll be available for students week 6 online. Shortly after doing the training, there'll be optional use for the remainder of summer quarter. Beginning fall quarter, it'll be mandatory. And we'll talk about how to transition our existing patients into the system. So first, let's look at some of the changes that you need to make in your options to Smart Cloud. Some of this we have already done, but let's just review some of this. So when you log in, you want to click on that blue rectangle in the upper left-hand corner. Then you want to click on the Options button. And you want to enable spell check. So the latest release of Smart Cloud now has spell check, but you have to enable it. Then you want to click on the Documentation tab, two rows below that, and click Hide ICD-9 tabs and Show Date Signed in Notes. Also, be sure that your default technique is chosen and your default ICD tab is going to be ICD-10 Favorites. Now, when you start a new note, you have to choose a note type. This began summer quarter. SOAP notes is a default, however, it will no longer be used. All notes prior to summer quarter were considered SOAP notes. Now you need to choose a type, and there's a type for every conceivable type of note that you can choose. You may need to scroll down to find that type. So in the history exam note, your first encounter with the patient, prior to even doing your history, you need to choose a problem. So the reason for care, you'll find that category under your ICD-10 Favorites is going to be a complaint. If your patient does not have a complaint, it will be Z00, which is an encounter for a general exam without a complaint or suspected or reported diagnosis. So again, now in your history exam notes, all the other significant health problems, you'll find categories for those in the ICD-10 Favorites tab. And you'll be selecting the particular problem. In this case, it's diabetes type 2. And in the onset comments box is where you're going to type your summary details. That's really important because in your reason for care, you do not use that box at all. However, in any of the significant other health problems, that is where you'll type the summary details for that problem. Now, in the CMR note, the reason for care will be updated to your higher level of understanding. So you need to deactivate the complaint ICD-10 code that you chose for your history exam notes. So when you right-click on the problem, you have choices. You want to deactivate it. And you're going to add a new problem at a higher level of understanding. In this case, it's going to be sprain of the cervical ligaments. If you don't have a problem, if the patient is a wellness case, your highest level of understanding will be a subluxation code. You want to choose the primary subluxation. The significant other health problems, you want to add those to the current notes. So for example, diabetes and allergy to penicillin. Okay? When you right click on those, you have the option to add those to the current note. You should have already added all of the significant details in the on-sent comments box in the history phys note. That'll still be there. For daily visits, as well as reassessment notes, you're going to view your problem list, but you're only adding the problems that you are managing or monitoring to the current note. So it provides you the ability to view all of the patient's problems, but again, you're only adding the ones that are being managed or monitored to the current note. If you need to find more information about a problem, in this case diabetes, if you double click on that, you'll see the summary details are written in the onset comments area. So now when do you update the problem list? There are certain trigger events that you need to look for. So whenever you're doing a CMR note, you'll always be updating that problem because you'll have a higher level of understanding. Whenever you perform an examination, whether it's a rephysical or a new complaint, you need to update the problem. If a patient has seen another healthcare provider, and we ask this on every visit, that may be a time to update the problem. If you receive any outside records, that may also be a time to update the problem. And if the problem meets the criteria to be deactivated and resolved, that is also another time you're going to be updating the problem list. So here's an algorithm to follow when you do have a trigger event. So you want to identify the problem that's associated with the trigger. So you review your problem list to see if that problem is listed. If it is, fine, end of process. If it's not, you need to consult with the faculty doctor who's supervising that visit to question them whether that new problem belongs there or not. If it doesn't, fine, end of process. If it does, the intern needs to add that problem to the problem list. Now, in addition to getting the permission from the supervising faculty doctor, you also need to send a message through SmartCloud to the doctor of record. The doctor of record is whoever performed the CMR on that patient. This will notify that doctor that the problem list was updated because that doctor is responsible for that patient. So when you right-click on a problem, you have several options. You can deactivate it, add it to the note, edit it, or resolve it. So whenever you have a higher level of understanding of the problem, you want to deactivate the current problem and add the new problem. You will not be resolving it because the problem is not resolved. If the chief complaint meets the criteria to be resolved, then you're going to deactivate and resolve the problem. When you receive documentation regarding a significant other health problem, it will depend. You may or may not have to deactivate it. You may or may not have to state the problem at a higher level of understanding. It all depends on what that documentation is. So I want to reiterate the fact that the supervising faculty clinician must approve changes to the problem list. So prior to signing off on that visit, make sure that they're aware if there needs to be a change to the problem list. Also, the doctor of record, and again, that's the doctor who signs off on the CMR, needs to be notified through the SmartCloud in-basket. So you're going to send a message to them through SmartCloud that the problem list for this patient has been updated. The doctor of record is ultimately responsible for maintaining that patient's record. Now, there may be times when a problem is added in error. Now there's no way of deleting a problem. These are your 4 choices: deactivate, add to current note, edit, or resolve. So when a problem is entered in error, in this example it's typhoid fever, you want to click deactivate and resolve. And you also want to edit it. You edit it in the onset comments box. There's a macro picker. Click on open up the macro picker and you'll find student error. This problem was added in error. You want to insert that macro. Then you'll see in the inactive problem records, you'll see that problem and you'll see the onset comments stating error.